Okay, so this program accompanies Chapter 9 in the OpenStax text. We're continuing on with the skeletal system and we're working on the joints. So I'm going to introduce the different types of joints and get to synovial joints, which will be the next big lecture. The joints are part of the skeletal system. The movement is determined by, or the force is provided by the muscles, but it's the shape of the joints, the materials in the joint that determines how much movement is there. So a joint is an articulation, a place where two or more bones come together, and different joints have different varying degrees of movement. We're going to talk about joints according to the structures, the tissues involved. In general, the function of joints is to hold structures together. They can permit voluntary motion. They don't have to. They permit growth and they permit shape changes. So 4 things: holding things together, movement, growth, and shape changes. Okay, we classify movement at joints according to whether it is like fused together. That would be synarthrotic joint, where there's very little to no movement. Amphiarthrotic is a slight amount of movement. And diarthrosis, those are freely movable joints, multiple positions. Okay, I won't say much about that kind of functional classification, but you'll read it. For us, we're more interested in talking about classification of joints by their tissues, their structure. Most tight joints are either made up of fibrous connective tissue, so they're a fibrous joint, or they're a cartilaginous joint, just cartilage involved. Those joints generally have limited movement. Fully movable joints are usually synovial joints. So we're going to go over these 3 groups of joints. So first, the fibrous joints. Those are joints that are where the bones are connected by fibrous connective tissue, bands. There's no cavity between them. They're not capable of a whole lot of movement, although some. And in some cases, like when we're passing through the birth canal, there's big areas of fibrous connective tissue, and then the bones of the skull move pretty rapidly. But these are going to permit growth. They'll hold structures together while allowing for growth. The best example of these are sutures. Sutures are joints between the broad, flat bones of the skull. As I mentioned, at birth, they're very large. We refer to them as fontanelles, and then there's quite a bit of movement. But later on, these will shrink, and eventually the bones of the skull will become fused, and so these sutures the fibrous connective tissue will be eventually replaced by bone. So that's a good example of a fibrous joint. Another example are syndesmoses, often 2 bones that are parallel, like the radius and the ulna here, or the tibia and the fibula. They're held together by fibrous connective tissue. They do move, but they're not freely movable, so it's more amphiarthrotic. These are called syndesmosis, and it's an interosseous ligament between the radius and the ulna, or the radioulnar syndesmosis, and they're just bands of connective tissue. Another one that I've mentioned to at least one group in lab are the fibrous joints that hold teeth in their sockets. Your dentist will call these periodontal ligaments, but in the book we use the term gomphosis. And this anchors the tooth very tightly into the socket, but permits the tooth to grow. And if your tooth gets hit hard enough, it can be knocked loose. But if the joint is not completely disrupted, it will tighten up again, and so will allow for it to heal. Okay, cartilage joints. Cartilage joints are held together by bands of hyaline cartilage or sometimes uh, uh, fibrous cartilage. Synchondroses are hyaline cartilage bands, and these form between the epiphysis and the diaphysis of the growing long bones, and they are the site of growth of those long bones. So epiphyseal plates are a good example of this. The costal cartilages that attach the bony parts of the rib to the bone of the sternum are synchondroses. Another example of cartilage joint is a symphysis joint, and these are bands that are stronger. Generally, they carry a lot of weight, and these are between the vertebrae. The intervertebral discs are symphysis, and we have a symphysis between the two pubis bones, holding the pubis bones together, the coxal. Okay, so then the last group of joints, which is a huge group, and we'll have a whole lecture on this, these are the synovial joints. Synovial joints are the freely movable joints. Generally, wherever there's lots of movement, fingers, wrist, elbows, shoulders, hip, knee, ankle, toe bones, these joints are going to be synovial joints, and they're complex. They have a joint surface that's very smooth and allows easy movement. That's the articular cartilage is the joint surface. But then this articular cartilage is wrapped within a fibrous joint capsule. So it has fibrous connective tissue surrounding the whole thing. And so the cartilages are protected in their own cavity, which is the synovial joint cavity. And then the inside of that fibrous capsule is lined by a synovial membrane, which is secreting a lubricating fluid that protects the joint, makes it move nice and smoothly, and this is going to cover the end of the bone that's in there. So a complex joint, cartilage, fibrous connective tissue, a special membrane, all in a capsule. This is all freely movable joints, and this is what we're going to talk about in the next program. So, summary: joints hold bones together wherever they meet. They hold the bones in position. They permit growth, shape changes, and allow classification, allow movement, excuse me. We classify the joints by either their amount of movement or by the types of tissues involved. For us, we're going to focus on the types of tissue. Fibrous joints include sutures between the bones of the skull, the gomphosis, which hold the teeth in their socket, or call them periodontal ligaments, and the syndesmoses that hold parallel long bones together and in position. Just fibrous connective tissue. Cartilage joints include the synchondroses and the symphysis. They're strong, they bear a lot of weight, not hugely movable. All the movable joints then are synovial joints. Complex structure, including articular cartilages protecting the surfaces that are interacting, a fibrous capsule enclosing the joint, and the joint space lined by a synovial membrane. This is a picture of the knee there, I think, and we'll go into the knee in more detail later. Okay, that looks good.